So, Aaron of SquatUniversity fame recently posted about Jefferson curl, and while I disagree with the stick, it's an extremely common one, so I thought I'd make a deep dive as to why I think about Jefferson curls the way I do. But before I do that, let's give the man some justice, and let's watch what he had to say.
You need to stop using the Jefferson curl for back pain. Here's a real-life example of why. Jordan came to me with low back pain, even trying to pick a barbell off the ground, with sciatica-like symptoms into his right hip. Now, if I had him hinge over at the hips with an RDL, he had no back pain. However, if he rounded his back progressively under load like a Jefferson curl, it recreated his low back pain and his sciatica symptoms because he had an active disc bulge. A disc bulge occurs over time as the collagen rings of the annulus are broken apart or delaminated. As the spine is then flexed and loaded, the hydraulic pressure of the nucleus is directed posterior, which then creates the disc bulge, which sparks pain. Progressive flexion and load of the Jefferson curl is therefore the exact trigger for this injury. Whereas if the spine is kept in a relative neutral posture and then loaded, the hydraulic pressure is balanced across the entire disc. Understanding spine biomechanics allows us to create a more optimal rehab environment for back pain.
Okay, so enough nonsense. Hi, my name is Alexi. I'm a physical therapist, and I actually read the papers that Aaron likes to cite once in a while. And I think his logic is really bad here, because if you use the same line of reasoning, you would say that, hey, you just sprained your ankle and it hurts when you walk. Walking's a bad exercise. You should never walk. You have knee pain? Oh, don't run. Running's actually bad for you, because it puts pressure on your knee, and that's bad, I guess. So it doesn't make sense, and I think the data kind of reflects that. For example, if you look at people with shoulder pain and examine how they move, like at this review, yeah, they move differently than people without pain. The problem with papers like this is that they only look at people once they already have the pain, the same way Aaron is doing with this patient right there. If instead you choose to look only at papers where you look at people before they have pain, which is called a prospective design, like this meta-analysis from 2020 did, well, what we observed then is that people who move abnormally with their scapula or their shoulder blade are not more at risk of developing shoulder pain or injuries in the future. Meaning, the difference that we observe in people who are already in pain or have a pathology is probably more a consequence. They're kind of limping with their shoulder because it's more comfortable. The same way the patient Aaron is seeing is probably doing with his back. In other words, just because something is painful when you're injured doesn't mean that's the movement that caused the injury or that it's dangerous in itself. Otherwise, again, getting back to walking or running, well, you should never do that because it hurt you once. We also know there's a poor correlation between pain and damage, so it doesn't mean that because it hurts that you're breaking something or that you should absolutely avoid it. Is it okay to modify movement once in a while? Absolutely. I do it all the time with my patients so they can keep their activities with minimal pain while they recover. It's called activity modification, and it's one of our main roles as physical therapists. The nuance is that when I do it, I always specify that the restrictions on movement are temporary, and that movement is probably fine when you're pain-free, and you can probably go back to it eventually once you're better and that the pain has settled down. If you're wondering why I cited a shoulder study in a discussion about low back pain, it's because the only prospective study I could find on kinematics, so the way people move, and back pain that was prospective was this one. Just one study, fairly small. There's like less than 30 participants. So this study looked at people already had low back pain, but it was temporary, and they were interested in who had a recurrence, so who had a second or third episode. And they saw that people who kept their spine more neutral were more likely to have a second or third episode. Small study, but that's better than nothing, Aaron. So again, it's always problematic to make blanket statements about movements and make like forever restrictions when it's something that's probably fine in pain-free people or to do with minimal pain. I use Jefferson curls in my practice, even when it's a little bit painful, and it seems to help. Again, that's the evidence, but that's the one Aaron is working with, so what do you want me to say? Another problem with the reasoning that Aaron is displaying here is that we know that the dynamic disc model that he's displaying doesn't seem to apply when there's damage to the disc, which is extremely common. So 6 out of the 13 studies that we have that are available on this show that the disc does not behave predictably when there's degeneration that's present. This is why this meta-analysis by Haney from 2009 suggests that we should not be as reductive when talking about damaged discs and the way they behave, because it's probably going to be stochastic, unlike what Aaron is presenting here with the disc bulge. In other words, saying that flexion pushes the disc back posteriorly and that extension pushes the disc back anteriorly is overly simplistic. It ignores the reality that degenerated discs are extremely common and part of normal aging, which we know from meta-analysis like the one from Brigman-Jikji from 2015. And these discs, as mentioned before, don't behave predictably. It's not that simple. Indeed, if we go back to that meta-analysis by Brain-Jigji, if you're in your 30s, there's a 52% chance that you have disc degeneration. If you're in your 40s, there's about a 70% chance, and it goes up linearly until your 80s, where it's 96% of the population. And that's only in people who don't have pain, so asymptomatic patients. In comparison, if we look at the rate of disc degeneration in people who do have pain, but in a meta-analysis by the same authors the same year, the risk of degeneration is 2.2 times higher. So let's put it all together and use your noggins here. And let's assume that this guy that Aaron is treating here is 30, which would put his risk of disc degeneration at 52% if he did not have symptoms. But we do know that he has symptoms. So 52% divided by 2.24, which is the increased risk that he's put at because he's symptomatic of having disc degeneration, which yields us to like about 75% chance that the disc is not behaving in a predictable manner, like not the way Aaron is describing. Is it okay to temporarily avoid flexion when it aggravates your patient? Absolutely, I do it all the time with my low back pain patient. It's called activity modification. It's one of the mainstays of treatment. The problem is when you extrapolate a single case of someone in pain, you extrapolate that to every person in the world, especially since we know that spinal flexion is unavoidable according to papers like the ones from McGill and this PhD thesis here by Corey Eddington from 2018, where we saw that 50% of the max spinal flexion range of motion was necessary to even squat and 80% to deadlift. We also know from large trials like this one and this one that there's a subset of people with low back pain or radiculopathies or other disc issues where we will see some people getting much better really quickly with repeated flexion. So if you tell them to bend their spine over and over, their leg symptoms disappear or their range of motion increases drastically, like in the immediate term, and they show really good improvements with that. The first trial where people responded really well to flexion, it was about 7%, and in the other as well. 7% might seem like a very small number, but remember that's only people who get a dramatic and really specific improvement with spinal flexion. In other people, movement in whatever direction is usually really helpful for low back pain as long as it's done in a tolerable fashion. So you can include flexion, you can include extension as long as it's tolerable. We have an example of this in trials like this one that compare an approach that tries to keep the spine as neutral as possible during movement, which is called core stabilization approaches, and cognitive functional therapy, which is aimed more at breaking down barriers and trying to gradually expose people to movement that's provocative, which often, like we said, is spinal flexion. And the result, surprise, it doesn't make a difference. So we should not be making blanket statements, and spinal flexion can have its place as long as it's reintroduced gradually, just like any other movement. There's also a subset of people with low back pain who have something called spinal stenosis. It's often asymptomatic, but when it's not, it causes a lot of pain to shoot down the legs when you're going into extension with your spine. But when you go into flexion, it feels pretty awesome, and it's like one of the rare things that you can do. So in these people, incorporating Jefferson curls could be a great idea to keep the spine strong, because muscle wasting of the spinal muscles is one of the big side effects of having low back pain for a long time. So that was a lot of words and a lot of studies, so let me sum it up quickly. Jefferson curls are fine if you want to try them. It's cool. Just go gradually and build up to them. If there's pain and you're not sure, consult a good physical therapist. And if you want to listen to SquatU, that's fine. Just be careful and take what he says with a grain of salt, because it's a big page and I don't think he has time to, really get into the nuance the same way losers like me do. So follow me, I guess. Okay, bye. So thank you for watching this video. If you're not already subscribed, hit the subscribe button, share, like, follow, and comment what I should review next. Anything to let the algorithm know that I'm a good little boy would be really appreciated, because these take a lot of time to do, and yeah, so it helps. Thank you. Peace out.